India has invited diplomats from more than 60 countries to visit local companies producing COVID-19 vaccines. It's part of government efforts to partner with other countries so vaccines can be made faster and distributed more widely. India plans to approve the use of vaccines within weeks. Neha Punia reports.
It's the first confirmation that the government will grant emergency authorization to a COVID-19 vaccine, and according to the Health Ministry, that approval could come through in the next couple of weeks. A senior panel that's been put together to mull this decision met on Wednesday, and sources say that the government is looking to accelerate its review of a COVID-19 vaccine. Last week, Prime Minister Modi visited several facilities where vaccines are being developed and manufactured to personally oversee the process. So far, 3 companies have approached the government seeking emergency authorization. Pfizer replied first. The US drug maker has sought approval for importing and selling the vaccine here. It's also seeking a go-ahead to skip clinical trials locally. Pfizer requires a temperature of -70 degrees Celsius, and experts say it's not the best fit for India's warm climate and inadequate cold storage facilities. There's also India's Bharat Biotech's Covaxin, but efficacy data for that isn't out yet. But the government's really banking on the AstraZeneca vaccine, which is being bulk produced in India by the Serum Institute. The world's largest vaccine maker says it can provide 100 million doses by January at a steeply discounted price. And as the prospect of a vaccine becomes real, the government says it's also finalizing its inoculation plan. The Health Ministry claims 300 million people would be inoculated immediately. This will include healthcare and frontline workers and senior citizens. Work to secure temperature-controlled containers and get them to different regions has also begun. 400,000 medical staff will be involved in the immunization drive, and the government says every Indian who needs to get vaccinated will. But equitable access remains a concern, and there are questions over whether or not this vaccine will be free and free for all. But the government says once emergency authorization comes through, India will approve mass production of these vaccines with an aim to inoculate 300 million Indians by mid-2021. Neha Punia, CNA, New Delhi.